Doctors have been warning for weeks of the overwhelming pressure on children's hospitals. This week, British Columbia reported 5 influenza-related deaths in children in November alone. Now, the chief coroner of Ontario is investigating the sudden and unexpected death of a child at a hospital outside of Toronto.
I cannot imagine how challenging this must be for the caregivers, the family of that patient. As a caregiver, as a parent, if you believe that you need to take your child to an emergency because you are not familiar with what is happening or are you concerned for their welfare, absolutely do it. There is nothing that we should be doing as leaders to suggest that individuals should hesitate at all.
Children's Healthcare Canada represents hospitals and health authorities all across the country. Emily Gruenwoldt is the president, and she's here with me in studio. Emily Gruenwoldt, I'd like to start with this terrible news out of Ontario, this story of a child dying in a hospital without having access to a stretcher, having access to a room. I mean, what's your reaction of where we are when you hear a story like that?
It's really sad. It's really scary as a parent to hear news like that out of Ontario today. But, you know, all across this country, we have a very large number of really sick children. This idea of an overnight crisis in pediatrics is actually decades in the making. We have an undersized healthcare system to serve what is a growing population of children and youth in this country. So we're seeing extraordinary measures being taken by our children's hospitals and by our community hospitals, desperately trying to create capacity to meet the needs of these sick kids.
What does it tell you about where we are, the strain on the hospitals right now? I mean, rooms aren't always available, but not even a stretcher in this case. It strikes me as a very extreme situation.
It is an extreme situation, absolutely. I think for years, though, our hospitals have been dealing with different demands for care as children evolve and as their needs are changing. So, you know, we've had this undersized healthcare system for quite some time. We're seeing children now waiting longer for essential services than adults, whether it's with respect to surgical interventions, mental health, whether it's child development assessments, or even diagnostics. And so we've had a longstanding challenge, and this latest surge with respect to the flu is just exposing all those cracks and really drawing attention to, you know, where do we go from here? What does that future plan look like?
When you say an undersized healthcare system, are you talking specifically about pediatrics here, you know, and medicine for children? And is it because of a lack of funding, or is it a lack of availability of the specialists required to build out the sort of system that you need?
All of the above.
All of the above?
So it is the children's healthcare system. So those organizations that are serving children under the age of 18, we're seeing dramatic shortages of highly specialized healthcare workers who take care of our children and youth in those centers. We're seeing physical infrastructure, hospitals, community centers that don't have the capacity and the space to prop up sort of flex space when we see a surge like this. But we're also talking about things like supply of essential medications. We're still in the midst of shortages of analgesics. There's shortages of antibiotics, shortages of medical devices. So all of this makes us realize that we don't have the supports and structures in place to care for the evolving needs of kids in Canada.
Is this avoidable? I mean, the situation we're in now, because we do have this rare storm of RSV, of COVID, of influenza. And, you know, it is difficult for any system, no matter how robust, to brace for a wave like this. But was this an avoidable situation, or was this an inevitable situation based on those circumstances?
I think that, you know, there's a lot of competing demands in our healthcare systems today, and we've seen extraordinary resources focused on other parts of the health system, and rightly so, but it can't come at the expense of children's healthcare systems either. So I think what we're seeing is, over time, we've seen the ratio or the percentage of investments in healthcare focused on children shrink. And that's for a number of reasons. You know, we've actually made some terrific medical advancements. We've enforced some really strong health policies. But the fact of the matter is, we need that capacity to care for kids in a situation like today, but also going forward. We're seeing more and more chronic disease, more and more concerns around children's mental health. So there's lots of reasons and opportunities to say children need to be our priority. We need to right size our healthcare system for kids.
I'm struck by this sort of perverse symmetry at the beginning of the pandemic. You know, it ripped through seniors' homes, long-term care. Tens of thousands of people died because of COVID. And here we are, kind of at the tail end of COVID, a lot of people would suggest, and these other viruses are coming in, and it's children who are acutely ill and acutely sick. And in the middle of all of this, we have these jurisdictional squabbles happening between federal and provincial health ministers, the prime minister, and the premiers. What's it like for you to look at the system with the strain it's facing now and look at really the inaction at the political level because of this jurisdictional fighting?
It's a bit frustrating, but I think the good news is we had the opportunity to present at the House of Commons Committee on Health a couple weeks back. They're undertaking a child health study. And what was heartening was the fact that all members of Parliament in that committee agreed on the fact that status quo is not an option for children's health, that we need a strategy that addresses specifically how we set milestones, targets, timelines to measurably improve children's health in this country. So I think there is momentum from that perspective. I think we're also seeing a sense of urgency that we haven't seen in the past with respect to children's health. I think by and large, most people thought the kids were doing just fine, but we're seeing now that that's not actually the case, and that we need to make dramatic investments and take dramatic action to improve children's health outcomes.
People may agree on an endpoint that things need to change and the status quo, can't stay, but it's how you get there, right? That's where the disagreements come in, and that seems to be the big issue right now with federal reform or with health reform and federal funding, provincial agreement on it. So we're going to hear from the premiers tomorrow. They're going to have a press conference. What do you want to hear from them in terms of maybe moving past this impasse that exists on the funding question?
I want to hear them commit to making children a priority as well, and their commitment to work with the federal government to create this joint action plan for kids. We know that there's lots of work to do. We know that it crosses jurisdictional boundaries, but we believe that now's the time that we can make this commitment and make sure that our kids thrive.
Okay, Emily Gruenwoldt, thank you so much for coming in.
You're welcome.